The House will come to order. Prayer by the Chaplain.
As the world awakens each spring, moving from death to life, so too we are awakened today, awakened to the past that we never forget the innocent, awakened to the present needs of your world, awakened to the promise of your presence, and awakened to your call to do great things. The tasks before us are challenging. How can we take care of so many and so much? And so as you call out to us, we call out to you. Help us govern with you, through you, and in you. Teach us to make friends with our questions and our doubts, to see them not as signs of weakness to be avoided, but thin places where we can better discern your gentle whisper. And at the end of the day, may we find peace, knowing what pleases you most is not any of our accomplishments, but rather our desire to want to please you.
The chaplain for today is Reverend Dr. Charles Ortloff from Gloria Dei Lutheran Church, Rochester, Minnesota. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America. The clerk will take the roll.
How you doing?
The clerk will close the roll. Quorum is present. The clerk will read the journal of the preceding day.
Journal of the House, 90th Session, 2017, 45th day, St. Paul, Minnesota, Thursday, April 20th, 2017.
If there is no objection, further reading of the journal will be dispensed with, and the journal will be approved as corrected by the chief clerk. Hearing no objection, the journal is approved as corrected by the chief clerk. Comparison reports. There's a copy of this order of business on each member's desk. If there's no objection, the motions will prevail. Hearing no objection, the motions prevail and the substitutions will be made. Second reading of Senate files.
Second reading, Senate file number 870.
Second reading.
Second reading, Senate file number 1020.
Second reading. Introduction of bills. The following House files have been offered for introduction today. The chief clerk will report the House files and give them their first reading.
Introduction of first reading of House files 2610 through 2615.
First reading, House files 2610 through 2615. Messages from the Senate.
Message from the Senate, Mr. Speaker, and this is the Erickson motion. I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House file number 140, an act relating to education. The message is signed Cal R. Ludeman, Secretary of the Senate. Erickson moves that the House refuse to concur in the Senate amendments to House File Number 140, that the Speaker appoint a conference committee of 3 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Mille Lacs, Representative Erickson. To your motion.
Thank you, Mr. Speaker and members. This is the teacher licensure file. We do not want to concur with the Senate. We have a few differences, so I ask that you appoint 3 conferees. Thank you.
Discussion on the motion to refuse to concur. Seeing no discussion, all those in favor signify by saying aye. Those opposed, no. The motion prevails.
A message from the Senate, and this is a Garofalo motion. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which amendments to concurrence of the House is respectfully requested. House file number 600, an act relating to employment. The message is signed Cal R. Ludeman, Secretary of the Senate. Garofalo moves that the House refuse to concur in the Senate amendments to House file number 600, that the Speaker appoint a conference committee of 3 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Dakota, Representative Garofalo. To your motion.
Mr. Speaker, that is my motion.
Any discussion on the Garofalo motion to refuse to concur? Hearing no discussion, all those in favor of that motion signify by saying aye. Those opposed, no. Motion prevails.
A message from the Senate, and this is the Gunther motion. Mr. Speaker, I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which the amendments, the concurrence of the House is respectfully requested. House file number 707, an act relating to state government, appropriating money from the Outdoor Heritage Fund. And the message is signed Cal R. Ludeman, Secretary of the Senate. Gunther moves that the House refuse to concur in the Senate amendments to House file number 707, that the Speaker appoint a conference committee of 5 members of the House, and that the House requests that a like committee be appointed by the Senate to confer on the disagreeing votes of the 2 houses.
Recognize the member from Martin County, Representative Gunther. To your motion.
Mr. Speaker, that is my motion.
Any discussion on the Gunther motion to refuse to concur? Seeing no discussion, all those in favor signify by saying aye. Those opposed, no. Motion prevails. Announcements by the Speaker.
Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House file number 140. Erickson, Bennett, and Mariani. Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House file number 600. Garofalo, Baker, and Poppy. Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on House File number 707. Gunther, Fabian, Torkelson, Green, and Lilly.
Messages from the Senate.
Okay. A message from the Senate. Mr. Speaker, I hereby announce the passage by the Senate of the following Senate files herewith transmitted. Senate file numbers 799, 844, 1030, and 1031.
First reading of Senate files.
First reading of Senate file number 799, an act relating to state government. Dean M. moved that Senate file number 799 and House file number 943, now on the General Register, be referred to the Chief Clerk for comparison. Hearing no objection, so ordered.
Hearing no objection, so ordered.
First reading Senate file number 844, an act relating to the environment. Fabian moved that Senate file number 844 and House file number 771, now on the General Register, be referred to the Chief Clerk for comparison.
Hearing no objection, so ordered.
First reading Senate file number 1030, an act relating to corrections. The bill is being referred to the Committee on Public Safety and Security Policy and Finance. First reading Senate file number 1031, an act relating to corrections. The bill is being referred to the Committee on Public Safety and Security Policy and Finance.
Hearing no objection, so ordered.
That's it.
Calendar for the day. The first bill on the calendar for today is House File 809. The clerk will report the bill.
House file number 809, number 1 on the calendar for the day, an act relating to health.
Recognize the member from Douglas, Representative Franzen, to introduce your bill.
Thank you, Mr. Speaker and members. Members, the purpose of this bill is very simple. House File 809 would stop the use of taxpayers from paying for abortion. It would do this by having Minnesota follow the same policy as the federal government, which has prohibited taxpayer funding of abortions for decades, with the exception of abortions done to save the life of a mother and in cases of rape and incest. Only one program would be affected by this legislation, and it is the state's Medicaid program. The federal government already prohibits taxpayer-funded abortions for women on Medicaid. Additionally, Minnesota's other programs already prohibit taxpayer-funded of abortions except in the cases of saving the life of the mother and in the cases of rape or incest. This legislation would apply the same restrictions to medical assistance. My constituents and I do not feel that we should be paying to end the life of an unborn child with an elected procedure called abortion. I believe that women deserve better than abortion. Providing free abortion does nothing to help women. In fact, it leaves that woman without her child. I think the state is better off providing real help and support to pregnant women. And for those who don't want to or unable to raise that child, we should be doing more education on adoption. From 1978 to 1994, Minnesota law prohibited taxpayer funding of abortions, except in cases of reported rape, incest, and the life of the mother. That all changed in 1995. Since 1995, taxpayers have paid for over 77,000 abortions in the excess of $23 million. For those of you on the other side of the aisle who are going to say that this is going to create discrepancies between women who are unable to afford an abortion and with those who are of means. I did some research this weekend, and actually there are organizations that do provide funding for abortions. Abortionfunds.organization, you enter in the zip code, and you can see right in Minnesota what organizations will give you some financial assistance. And then there's an abortion assistance fund on prochoiceresources.org, where they provide no interest loans and grants to those who do want an abortion but unable to afford it. So even without taxpayers funding abortion, there are still resources out available for those who want to end the life of their child. And with that, Mr. Speaker.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 809.
Third reading. Discussion on House File 809. The member from Olmsted, Representative Liebling.
Mr. Speaker and members, here we go again. We've had this same debate over and over in the time that I've been in this legislature, and it seems to never get old for those who want to bring these kind of bills to tell women what kind of health care they should be able to get. You know, it's interesting that Representative Franson mentioned some places where people can get perhaps some funding if they want an abortion and they can't get it funded through their health insurance. And I'm sure that there are some women in other states who probably need that information, and there are probably some women who don't qualify for Medicaid, medical assistance in Minnesota, who probably are grateful for that information. So thank you, Representative Franson, for sharing that. But nevertheless, we don't tell women that if they want, you know, other kinds of health care, that they should go and seek charity to be able to have that. Whether a woman wants to carry a child to term or you know, there are a lot of things that can happen in women's lives. We had a press availability this morning, and we heard from 3 women who have had abortions, and they discussed their very different circumstances in which those things occurred. Now, none of them talked about whether they were on Medicaid or not, but it shouldn't matter. It shouldn't matter how a woman gets her health care, how she gets her insurance. It ought to be her own business. Her own business, whether she feels that she can carry the pregnancy to term or not. And you know, the portrayal of women as doing this for some kind of frivolous reason is so unfair and so inaccurate. And when you listen to women who have gone through this experience, you know, one of the women was talking about having a fetal anomaly that was incompatible with life. You know, to say to that woman that we, the politicians, are going to tell her that she can't make a decision about what to do about that pregnancy with privacy, with her health care provider, with her husband, with her clergy, that is just wrong. You know, it just strikes me that we so often hear the Republican Party talking about limited government and local control. Boy, we have sure seen that those things really don't mean anything this year. We've seen it in a lot of places, but we sure see it in this area. Limited government, but not too limited to tell women what they can do with their own very, very private, personal decisions.
The member from Washington, Representative Lomer.
Thank you, Mr. Speaker and members, and I want to thank Representative Franson for carrying this bill today. You know, I'm very saddened with every speech that I hear that supports abortion today, and I'm sure there will be more than Representative Liebling. Abortion is the taking of a life, a young life with a beating heart. Since Roe versus Wade in the 70s, over 60 million children have been aborted, and over 60 million women have had to live with the consequences of a decision that has lifelong consequences. Abortion may be legal in this country, but no taxpayer should be forced to participate with their tax dollars for the taking of this life. I had a bill last year to redirect funds from Planned Parenthood to comprehensive health clinics to truly help women in crisis and in need, and it would have saved the lives of the lives in the poor and minority communities. That was my goal. It's ludicrous to say that we don't care about poor women. We do, and we know that abortion hurts all women. I hope they're passing out a story. Yesterday on the front page of the Minneapolis paper, you may have seen the story of my good friend Michaela Holmgren. And some of you might remember this young woman. She's 22 years old, and she has Down syndrome. She was in committee several years ago testifying to my bill, which required physicians to give complete, up-to-date, and accurate information to expectant mothers who find they are carrying a baby with Down syndrome. Michaela did a fantastic job of testifying, using her cell phone to read her testimony, and I was so happy to see that the governor signed that bill. Taxpayers have been forced to pay for abortions for women on medical assistance whose unborn children have birth defects and disabilities, as if those children are not valuable and do not have any worth to our society at large. You've all heard me talk about my son with spina bifida. He works at Gillette Hospital and helps children every day who are getting ready for surgeries. He's the one that's had over 80 surgeries, by the way. And he's there to help them post-op as well. Often he's the one they call up to the floor to encourage kids who need a bit of encouragement to get up and walk post-surgery. Those kids and families love my son, and who can relate to them and their fears like no one else. So Michaela, when you get the story, you'll see it. She will be running in the Miss Minnesota Beauty Pageant, and I'm so thrilled that she's been accepted to be a candidate. To quote Jordan Buckalow, director of the Minnesota Miss Amazing Pageant, to have women from all walks of life truly be represented on stage shows that pageants are accessible for all, and beauty isn't just a box that we can fit in. Michaela is a joy to all who know her and is an encouragement to all of us, but especially those in the disabled community. Michaela's life is precious. All life is precious. Over 60% of people in this country do not support their tax dollars being used to fund abortion. I stand with that majority, and I ask you today for a green vote. Thank you.
Recognize the member from Anoka, Representative Whalen.
Thank you, Mr. Speaker, and thank you, members. Thank you, Representative Franzen, for carrying this bill. I want to echo some of the things Representative Lomer stated. But first, also just to respond to Representative Liebling's comment about here we go again. Members, the truth doesn't change. We will keep going because abortion is ending a life. It takes a life. I didn't decide this, God did. It's very clear in the Psalms, He knits us together in our mother's womb. You might not agree, but I hope we can agree that I shouldn't be forced to violate a sincerely held belief with my taxpayer dollars going to fund abortion. I really like the way Representative Lomer phrased it. No Minnesotan should be forced to participate in the taking of a life. And members, there are alternatives. There are so many groups that want to reach out and help these women. And so I would just encourage you, do a quick online search, alternatives to abortion. There are many resources available. Our tax dollars could be spent better places. Thank you.
I recognize the member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. And I have to rise in support of the women of Minnesota, of women of means, of women who are struggling financially. And recognize the fact that all of these women, regardless of their financial situation, deserve access to comprehensive health care. And they deserve it in a situation that provides them dignity and privacy and scientifically proven care. They don't deserve the judgment of the Minnesota State Legislature when they're making their health care decisions. And I've heard members already today talking about women who seek abortion like they should be shamed, like they are somehow damaged human beings, like they are somehow incapable of making their own health care decisions. And so I'm standing up for the women of Minnesota who I know are strong, smart, capable. Some have said above average on a certain radio show. And that's the way that the Minnesota legislature should treat them. There's not something wrong with the women of Minnesota that we need to get involved in their healthcare decision making. But for people who want to, and I think it's perfectly fine for people to make their opinions known, to talk about your values around, familial values around abortion in your families, in your faith community. Those are important things to talk about. Your truth is important to understand, and so it's perfectly fine to have this conversation, but it's not okay for the legislature to tell women that they don't deserve the same privacy and dignity and care based on their financial circumstances. So that's the first thing I'll say. The second thing I'll say is we're debating this in the legislature, but the fact is this is no longer a legislative issue. The state Supreme Court has spoken. The state Supreme Court has spoken on the side of justice for women who are not wealthy. The state Supreme Court has said that there needs to be parity in terms of the health care that wealthy women receive and that poor women receive in this state. And because of that, women have autonomy to make their own health care decisions. Women have autonomy to make their own decisions about when to become a parent and whether to become a parent. And those healthcare decisions extend far beyond abortion. The fact is we need to make sure that the entire range of comprehensive health care and health education are available to the women of this state, regardless of their financial situation. And so I stand for the women of Minnesota to say, I trust you to make decisions for your own health care, and I, as a state legislator, am not going to take away your dignity or your privacy.
The member from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker, and thank you, members. I wish we weren't doing this bill today or any day, really, especially when we've just got 4 weeks left, no budget targets. Minnesotans expecting us to adopt a budget, deal with transportation, pass an infrastructure bill, but here we are, wasting our precious time. Representative Lomer, in her speech, said that she believes that abortion hurts women, that it causes harm to women. We've heard that before on this floor. I know there are members that believe that, though I'm not quite sure where you get your belief, though I, would attest to the fact that you believe it. What I hear from women about what hurts them when we continue to take up this political issue is that by your action, yours and the members of your caucus, you are inserting yourself and your views into a decision that should be between a woman and her family and her faith community, her pastor, and her physician. We have no business in the middle of that. We have no business being in the middle of that private decision. And yet you insist inserting yourself in there. The other thing that hurts women each time we take this step is we are telling them that they're not capable of making this decision for themselves, that they're not capable or entitled to make this decision for themselves, that we believe we're smarter than they are. And I think it's time to knock it off.
The member from Anoka, Representative Scott.
Thank you, Mr. Chair. And as Representative Halverson stood and said she's standing for the women of Minnesota, I'm going to stand for the women of Minnesota too, the ones that have not yet been born. If we look at the statistic that since Roe v. Wade passed, 60 million children across this country have been aborted. Their lives have been snuffed out. Approximately half of those were women. So if we look around our country today, approximately 30 million women are missing. So I'm here to stand for their rights.
The member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Members, when we do these bills, we invariably stand up and talk to our own base, our own constituency. And some people who come up to the Capitol and watch, they think we're here and we try to persuade each other in this great debate. And that's not going to happen today. That won't happen on this issue as long as I'm alive, I don't think. But I am going to take a different tack today, Mr. Speaker and members, because some of the things that I've heard revealed to me that there is no desire to persuade. There's no desire to reach an understanding. When I hear someone call Representative Liebling pro-abortion because she believes in a woman's right to choose, you didn't see my eyes roll, but they did. When I hear someone being so convinced that it's a life and needs to be protected, I will reveal one thing to many of you that do not know this about me. When I was in high school, I marched in pro-life marches. I did. Grew up Catholic. And then I went to college and I understood the nature of our country, how we make laws, and how we do not impose faith or religion upon others. It is a foundation of our country. And so you may believe all day long that it's a life at conception, and congratulations. But you cannot impose that faith upon another. You may believe it as much as the day is long. You may say, absolutely, I'm convinced. But I have an undergraduate degree in philosophy, not just philosophy, but Catholic philosophy. I went through the entire rigmarole. I could repeat this debate ad nauseum, but the Constitution protects persons. And you came up here, and if you swore an oath, you may have put your hand on a Bible and swore an oath to uphold that Constitution. You did not place your hand on the Constitution and swear to uphold the Bible. It's been said before, and it's just as valid now. But until you put your morals where your mouth is, and I see you passing legislation that shows you are pro-life, not just pro-birth, when I see legislation that supports children's health care, affordable child care, early childhood education at MFIP, I might start to be persuaded in the sincerity. But that's not going to happen today based on what I've heard. I sincerely hope that someday, maybe it will.
The member from Carver, Representative Pugh.
Thank you, Mr. Speaker. Minnesotans don't want their tax dollars to be spent funding abortions. In fact, there are 33 other states and the federal government who have this measure that we're discussing here today in place. This legislation to ban taxpayer funding abortion is very important to me, as it is to my district, especially given that I represent one of the highest tax districts in the state of Minnesota. This legislation has been criticized in the past. In fact, it's been criticized right here today on the House floor, that it's a waste of time and that this legislation shouldn't pass because it's unconstitutional. But members, it's our job as legislators. It isn't our job to decide what's constitutional and what isn't. That is the job for the courts. As legislators, it's our primary responsibility to represent our individual districts and the constituents that we serve. In fact, I've heard from Minnesotans all across the state who know what my position is on this issue, and I think I've heard from them because they want to be heard, and I was somebody who listened to their concern. The issue of abortion, and much more specifically, and that's what we're here to talk about today, whether our tax dollars should pay for others' abortions, is a concern I hear about from my constituency on an ongoing basis. In fact, as a result, it's clear to me that a majority of my constituents, including some who are pro-choice, do not want their taxpayer dollars used for this purpose. I've spoken with constituents who believe this. I ask for your support on this legislation because I sincerely believe it's the right thing to do, and because I believe most Minnesotans believe that this is the right thing to do. So I thank you, Mr. Speaker. I thank you, members, and I thank you, Representative Franson, for having brought this bill.
The member from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker and members. You've heard me many times speak about the need for comprehensive health coverage for all. And we've dealt with that in many steps forward since I was first elected, from debating having preventative care covered outside of high deductibles, from ensuring that children under age of 5 didn't get branded with pre-existing conditions because they had a headache that wouldn't go away, and their parents took them to the hospital emergency room, and it went away on its own. And 2 years later, when their employer dropped family coverage, that little boy, 4 years old, couldn't get coverage because he had a pre-existing condition, because he had a headache at 2 and couldn't communicate enough about what was happening, so they took him in for care. Well, this to me is just another step backwards in saying that we believe in comprehensive coverage for people, for whether they're men or women. When we buy medical assistance policies for people, we are buying comprehensive health care for those people who can't afford it on their own. And we should not sit in judgment and decide that some poor people have access to only certain things, and people of other means or who are lucky enough to have an employer who pays for coverage have access to others. We should not be denying anyone covered by our policies access to the full range of legal, safe, and comprehensive coverage. Nor should we, in a year when you are cutting the budgets of all of our state agencies and all of our support, should we be running another test case up the legal court system when we already have a fairly definitive Minnesota Supreme Court ruling that has withstood all of these years? And we should not take away the right of women, no matter what their economic circumstances are, to take advantage of a comprehensive coverage of health insurance. I trust them, their doctors, their faith leaders, and their family to make the right choice.
The member from Anoka, Representative Whalen.
Thank you, Mr. Speaker. Just wanted to respond to a few things that I've been hearing in the debate, and in particular to Representative Lesh, the desire to speak truth, and that often on the floor we don't really hope to persuade, or we don't think we can persuade. And I completely understand your frustration, and I don't necessarily disagree. But I will say this: I hope to persuade. I do. I hope that hearts and minds are opened. I hope that people listening at home, listening in the gallery, I hope that you are persuaded, because at the end of the day, as I said before, truth doesn't change. Truth is not going to change. Abortion takes a life. And to the point that this is a religious freedom issue, my religious freedom and the religious freedom of many Minnesotans who believe that this is wrong and this violates their beliefs, it's a violation on them. It's a violation on the religious freedom of Minnesotans who are being forced to fund a practice that goes against their sincerely held religious beliefs.
The member from Hennepin, Representative Flanagan.
Thank you, Mr. Speaker. Will Representative yield for a question? Representative Franson yield for a question.
She will yield. Representative Flanagan.
I'm wondering if Representative Franson could tell us how many women on medical assistance she's spoken to regarding putting together this bill.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. Members, this is a bill that we bring forward every year through MCCL, and that the taxpayers have asked for this bill to be put forward.
Representative Flanagan.
Thank you, Mr. Speaker. Well, thank you for answering my question, because I think that answers a lot of questions. We have a habit, and we're developing a habit, of not listening to low-income women and not listening to women of color within the legislature. When we make these decisions without the people who are directly affected by them, we're not doing our job. Thank you.
Any further discussion? The member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. You know, it saddens me that we've heard some comments how we are judging women and that we think less of women who are getting abortions. I think abortion is a very serious issue. It's a very sad issue. And when I have met women who have had abortions and spoken to them, and there is a sadness in them, there is a deep, deep loss of a child. And I just want to love on those women. To be put in a position where you think that your only choice is to end the life of your baby in order to continue on with your life is extremely sad. And so when we have these conversations, I would hope that you would not say that we're passing judgment, because that's not, my faith doesn't tell me to pass judgment on women. It says to pray for them and to love on them. To love them like Jesus would love them. But we get involved with the abortion debate because taxpayers are paying for abortion. Also, science says life begins at conception. You know, when there is the meeting of the sperm with the egg, there is a flash of light, the moment of conception. And scientists have said life begins at conception. And also, abortion is not health care. It ends the heartbeat, the life of an unborn child. But this bill in front of us does not prohibit abortions. It simply states that taxpayers will no longer pay for the elective procedure, which is already prohibited in federal law. Thank you, members.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 77 ayes and 54 nays, the bill is passed and its title agreed to.